Well, as we face the fall, we are far from temperatures actually falling. Some of the hottest weather is still to come. You'll remember those several days of heat advisories just last month. Student athletes need to take it slow when getting back on the field for a lot of different reasons. Joining me this morning is Baptist Health Cardiologist Dr. Chetan Hampole. Good morning. Thank you so much for joining us today.
Good morning. Thank you for having me.
Yeah, it's important, especially when we're talking about our kids and the work that they do out there on the field. The American Heart Association really right now urging everyone to be careful in this heat. But as we know, teens tend to think they are really invincible. So would you explain the risk of heat stroke?
Sure. So traditionally, we think about patients who are at risk having risk factors. And so things like being elderly, patients with prior known heart disease, prior stroke, having risk factors for heart disease like hypertension, being overweight or obese. But a lot of the principles, I think, of managing the heat can be extrapolated to the general population.
So what are those symptoms? Because, we get hot, we start to sweat. That's kind of that first signal that, hey, we need to start to monitor this, or that's our body's way of cooling off. What are the symptoms when you really need to kind of take action and maybe get out of the sun or even go to the hospital?
Sure. So the symptoms of heat exhaustion include things like dizziness, confusion, headaches, nausea, vomiting. People can even notice that their pulse becomes weak and thready. So those are some of the few. And then if you think about the difference between heat exhaustion and heat stroke has a lot of the same symptoms, but really are more pronounced and can ultimately lead to loss of consciousness and even death.
For teenagers feeling that pressure to perform, they are competing for the position and they don't want to call themselves out. They don't want to pull out of the game. So your message to students who might ignore some of those symptoms you were talking about?
So my message is, if you think back, so there was a famous case of Corey Stringer. Corey Stringer was a professional athlete and he was an NFL football player on the Minnesota Vikings. And this month, actually, 20 years ago, he died of complications related to heat stroke while at training camp for the Vikings. And so it's something that really, that case is what brought a lot of national attention to this issue and has changed the way that teams and athletes have thought about training in the summertime heat.
Yeah, it's important to have those examples so that, kids and adults know that we have to take action. And just quickly, let's just go into talking about older people or maybe some that are on medication. You work out, you work in the heat. Are there some medications that make you more susceptible to heat stroke or heat-related illness?
Sure. The typical ones that I would think about would be things like certain blood pressure medications and then common diuretics or water pills that a lot of our patients who have heart disease are on that can exacerbate the problems that are associated with heat exhaustion.
All right, Dr. Hampole, thank you so much for your time today.
Thank you.